I'm Howard Bunting. I'm a Christian and I'm an ophthalmology consultant in the NHS in the United Kingdom. And I've been coming to Lighthouse for Christ for a number of years. First time back in 2010 and come back 3 times in the past. This is the 4th visit. Yeah. I became a Christian 20 years ago. As a doctor, I obviously wanted to understand how the needs elsewhere in the world. Always been interested in finding out how I could serve across the world. Yeah, there are a couple of countries that particularly got put on my heart. One of them being Kenya, the other one being Madagascar, and so I've been involved in those projects over these last years. But particularly when I when we're looking back in 2010 and looking at the websites and so on, and I saw all that Lighthouse was doing, and I saw the kind of the needs, possible need for training of the doctors and so on. I was really excited to be able to apply and find out more from the mission director at the time. I think that it's been really encouraging to see the way that the staff work together here at Lighthouse. It's a challenging place because the patients have lots of difficult conditions to contend with, particularly in my area of expertise, which is children. You see time and time again children losing their sight, and so much more could be done for them. But by way of encouragement, I just have seen like the doctor who's worked here, Dr. Matendi, who's worked here for years, some of the training that he's been able to get from many different people, and the way that he can help those children now in a way that he couldn't before. So it's fantastic actually to see how Lighthouse has really blessed so many children. It's a fantastic place to come, and you may think you're coming here to do loads and loads of surgery. Not necessarily to do that. You're here to encourage the people, to encourage the team, and to train them. If you've got those skills, it's an awesome place to come. Wherever we're working, we're in a resource-restricted setting, so there's always a difficulty managing to get the resources required for the patients. And when you see it here, there are lessons to be learned for when you're back, in your home country. How can we actually use the resources more effectively? I think that's one big thing. But some of the kind of trauma and complex cases that you see here are so common that those skills are actually something that are fantastic to be able to see and learn from for back in the UK, for sure.
Hi, I'm Josh Greist, Mission Director of the Lighthouse for Christ mission in Mombasa, Kenya. If you would like to hear more about what you've seen, head over to our website. Thanks.